One of the many ways the second Trump administration has upended U.S. policy is in healthcare, especially when it comes to vaccines. So this week, the CDC is debating a number of new vaccination standards, and California is getting ahead of any changes with its own policies. So just yesterday, the so-called West Coast Health Alliance, which includes California, they released new vaccine guidelines that break from the Trump administration. Our Lauren Tom spoke with local medical professionals about the vaccine clash, creating confusion for families.
What we are seeing, we've never had before.
In a historic break from federal recommendations, California is among several states publishing their own broadened vaccine recommendations after the CDC scaled back its guidelines, recommending this year's COVID shot should only be for seniors and at-risk people. State health officials say that's not enough to keep people safe. The West Coast Health Alliance, which includes California, Oregon, Washington, and Hawaii, released separate guidance for the upcoming winter. That includes recommending the COVID vaccine for children aged 6 to 23 months, pregnant women, and people in close contact with anyone at risk of severe illness. Dr. Yasko Fukuda says the sudden change in federal guidance and the uncertainty behind it has created confusion for families and doctors.
It's very confusing for my families. You know, I talk to families every single day. What's the best thing we're supposed to do? Oh, my goodness.
A San Francisco-based pediatrician and former president of the local chapter of the American Academy of Pediatrics, she says the sudden narrowing of federal immunization guidelines is unusual.
We have had a very long-standing process of who are on these different committees to give their input.
California's new recommendations don't stop with COVID. The state is also encouraging flu shots for all ages and RSV shots for infants, pregnant women, and seniors.
We're choosing to trust our Department of Public Health. It's a good short-term solution. I hope it'll stay good in the long term.
UCSF professor of law Dorit Rice warns that the federal changes could limit access nationwide.
One concern is that private insurers, or at least some of them, will stop covering the unrecommended vaccine and people won't have access.
Governor Gavin Newsom signed a law Wednesday which mandates insurers cover the vaccines the state endorses. The break from CDC guidance comes at a time of upheaval for the agency. In sworn testimony on Capitol Hill this week, fired CDC Director Susan Menares says she was pressured by Health and Human Services Secretary Robert F. Kennedy Jr. to sign off on the committee's recommendations without first considering scientific evidence.
Based on what I observed during my tenure, there is a real risk that recommendations could be made restricting access to vaccines for children and others in need without rigorous scientific review.
It's taking a toll on all of us, time away from other things that we could be doing, and it's a source of frustration.
Dr. Sam Pejam says the debate isn't just about policy. It could put lives at risk, particularly ahead of the winter virus season.
It's hard to imagine this has all been discussed based on evidence and not based on politics. And again, we really should practice medicine based on the evidence that we have and get the politics out of medicine.
The CDC maintains that its scaled back recommendations are meant to focus on those at highest risk, arguing healthy children and adults face less risk of severe illness. But Dr. Fukuda says recommendations should consider the entire population.
If we can have every effort to protect everyone, I think that will be very, would be wonderful.
Meantime, after a tense debate, the CDC's Advisory Committee on Immunization Practices voted today to change recommendations for one vaccine. Specifically, the panel voted to not recommend the combined MMRV vaccine for children under 4. The committee is instead recommending children under 4 should get one shot for measles, mumps, and rubella, and then a separate one for chickenpox. The combined shot carries a slightly higher risk of seizures when used as the first dose in young toddlers. But the change prompted some pushback.
But if a parent wants to get a single dose, why are we taking away that option?
This recommendation is going to create more confusion among the public.
Tomorrow, the CDC panel is set to vote on hepatitis B and COVID-19 vaccine recommendations. So we'll be following the latest developments. And if you want to learn more about the new California vaccine guidelines, just head to our website, KPIX.com.